were Latinos among uncovered and undercovered Americans among the biggest losers in this debate?
Well, the thing was that the bills coming out of Congress were doing a one-size-fits-all, and you're absolutely right. They weren't looking at these specific issues that are of concern to Hispanic communities, and so I don't see them as losing out. I think that this is an opportunity for us to get our voice out there and to put down that there are specific concerns that affect the Hispanic community. Like I said earlier about the fact that we work for a lot of employers, bring that out. And actually create a system that will work for us and for all Americans will have a choice, and the quality of healthcare won't suffer. And so, no, I don't think that we lost. I think that there's an opportunity for us to start anew.
So if you're a restaurant worker in Brooklyn, a garment worker in Los Angeles, a small business owner in San Antonio, you didn't lose because nothing is going to happen?
Absolutely no. What we should demand is that we create a system like members of Congress have. I mean, they get to choose from about 20 to 40 different private health insurance plans. We say let's have something that is similar to them. Why do we have to be forced into a public plan? We should have the same type of quality of health care that members of Congress get.
Does this process and the way it stands today in February 2010, Michael, bring any of the 40-some million or so who don't have coverage closer to being able to get health care?
No, I don't think that anything that we do this year is going to do that. And I think that we all have lost something in this debate, which is an opportunity. We've lost an opportunity to make serious health care reforms that will lower the cost of care, bring it into the reach of more people, and improve the quality of care. And you know, how do we do that? Well, the way we do that in other areas is we let inefficient producers go out of business. We let the buggy whip manufacturers go out of business because someone invented an automobile which meets people's needs better than the horse and carriage did. We let IBM go out of business because Microsoft is making better computers than IBM. But inefficient healthcare providers don't go out of business. And the reason is because the government controls so much of our healthcare sector, and those special interests, the inefficient providers, control the government because they're the ones that the government hears from. So, and we can't say, well, we'll just try to take money away from the special interests when we've tried to do that before, when Democrats, for example, have tried to do this in years past, where they just cut government subsidies to the drug companies or the health insurance companies, then those special interests block that legislation. What we need to do is we need to take away the power of government to control our healthcare. We need to take power away from politicians, power away from bureaucrats, give it, and even power away from employers to control part of our earnings that purchases our healthcare. Give that power back to individuals, back to workers. Let us purchase our own health insurance, force health insurers to compete for our dollars, and doctors and hospitals and drug companies as well. And then we have to be willing to let the inefficient producers go out of business when someone comes along and provides us better health care at a lower price. That's not going to happen until you take the power out of the hands of politicians and
Karen,
bureaucrats.
would that work?
You know, I think Michael and I agree a lot on problems and probably a lot on goals, but very little on the strategies of how to reach them and how to reach those goals. I think certainly we need to be thinking about how do we reward efficient providers and high quality providers, and there's a lot in the bills that are pending in Congress that are going to really move us towards doing that. First with public sector payments, but I think also with the public and private payers working together. I think that you know, if you're looking at taking government out of healthcare, taking employers out of healthcare, what you're really talking about is such a radical change in our healthcare system that we don't know how that would turn out. But what we do know is that people would experience enormous upheaval. I think if you look at the last time we really had a head-to-head exchange of ideas on healthcare, I think was the 2008 campaign, because I would say that the Republican leaders in Congress haven't really been pushing solutions in this debate in Congress. But if you look at the proposal that Senator McCain was advancing as a presidential candidate, and then what now President Obama was putting forward, the kind of changes in the upheaval and the uncertainty that the McCain approach of really undoing the employer-based healthcare system and having everybody purchase insurance on their own, I think that was something that created enormous uncertainty and anxiety among the public.
given who's really out there in the market, would creating this marketplace really be an answer, or would it just open up a new set of problems for people who wouldn't shop well, people who wouldn't understand their options, people who would have a hard time buying insurance if now part of their assignment as adults was to go out there and buy insurance when, frankly, they've never had to do it before?
Right. No, I think that's a very good question, and I think that gets at the heart of making citizens more responsible and making them more educated about the options that are out there. The example I mentioned about members of Congress, obviously members of Congress understand somewhat, healthcare and have the tools at least to be able to decide for themselves. And so, for our Hispanic community, what would be necessary for it to be some type of other outlets, perhaps community groups, churches, who would help our community understand the options that are out there. But unfortunately, the left doesn't want to do that. They want to decide for them what works best for them. And so that really gets at the heart of the question in this debate as it moves forward, because I want more of our community to understand the options that are out there and not just be forced into a government plan.
I just have to say, when you hear you talk about having a plan like the members of Congress, when I think of the reformed marketplace that is part of these bills, the insurance exchange, that whole idea there is for people to have a range of plans that they can choose from. They can use their own money. They can be in that exchange because they work for a small business. They would have subsidies from the government if they're low enough income to help them pay for coverage. And there would be standards of what kind of information health insurance plans would have to provide so that people could do some comparison shopping across plans. So I'm not really clear how you think this isn't going to work.
If I'm not mistaken, I think there isn't a public plan within the choices that members of Congress have. And so I think that's what I was getting at, is I think there was a lot of, within the Hispanic community, a lot of leaders were saying, support the public option because that's really the best we can get. And so what I was trying to say is, no, we shouldn't just be forced into the public plan. Why can't we look at other private health insurance plans, because they could be better?
Because I want to jump in here and agree with Karen, because I think that the proposal the Heritage Foundation has talked about, where we give Americans access to the kind of health insurance exchange that members of Congress have, is very similar to what's in this legislation. It is, this legislation, the Senate bill would create a similar exchange in each state. The House bill would create one national exchange similar to what members of Congress have. And now, I don't think that that's a good idea, but I do think that there are a lot of similarities between those two approaches.